I'm David Hoyt. I'm the Executive Director of the American College of Surgeons, and I want to start out by thanking everybody for coming this morning to the first Chicago Surgical Healthcare Quality Forum. To summarize why we're bringing this to the public today, why we're launching a campaign, why we're recommitting ourselves to this effort, is because we really have a way to bring improving quality care and lowering costs together, and it's led to this concept of an inspiring quality.
What we can ill afford to do is to tolerate disparities in quality. The college started with the emphasis on quality, and that's the whole emphasis of this forum.
As we go forward with budget deficits and debt discussion, healthcare is a major focus of what we're going to do. And my hope is to, over the long term, provide a vision for where we would like to go, which would provide more direct relationships between the patient and their physician, and fewer controls by bureaucrats in Washington, D.C.
The partnership that we've created with the college around the NSQIP program allows us to work together using the NSQIP data and using the Center for Transforming Healthcare's very effective process improvement tools to figure out exactly what it is about preoperative, intraoperative, postoperative management that explains these very wide variations that we see in risk-adjusted complication rates. And then, when we find those discoveries, the Joint Commission's job is to disseminate those findings very widely to our 19,000 accredited organizations. So it's not just the individual organizations that benefit, but the entire delivery system.
I needed a tool to really see how we measured and how we stack up against similar community hospitals, and we faced the same challenges that Senator Kirk was mentioning: maintaining staff, keeping general surgeons engaged, having great quality surgical care, and having a spectrum of surgical services. We entered the NSQIP program, and a lot of very good things have come from that.
We know that carotid endarterectomy is superior to medical therapy, but there is an important issue. If the surgical outcomes are not perfect, then you lose the advantage. Shouldn't we monitor in this field as we do for transplant, for bariatric surgery, for bypass? I think we should do more and more, especially in specialties that are costly and involve a lot of public opinion perception, investment from the government. And I would suggest that the college should take the leadership.
At the University of Chicago, we have definitely taken the lead in the area of quality, inspired by the work from the American College of Surgeons. We were forced to take a very hard look at ourselves back in 2006 when some of the data started coming out from the SCIP project, which measures certain core performance standards in terms of prevention of infection, prevention of venous thrombosis and other activities. And we found, to our surprise, that despite our pride on an ability to handle the most challenging cases, that in some of these routine matters we were falling short of our own standards. And that really motivated us to unify around quality, to focus and build the infrastructure at the University of Chicago to create this culture of quality improvement. And within 18 months, we transformed our performance on these measures to achieve 100% compliance and sustain those results on the subsequent 2 years. So this works when you do it in an organization.
We have had the opportunity over the last several years to work with the American College through their Clinical Scholars Program, and we have identified areas across pediatric care that need improvement and opportunities that we can participate in.
We were an early adopter of NSQIP, and we've really used that in our quality improvement programs. But we also knew that a cultural change was really necessary, not only among physicians, but among the staff as well. And so for everybody coming into the OR environment, they need to take part in a team training effort. We've seen a 30% decrease in claims over the last 5 years related to surgical care, and I think that's very important. We've put in place an anonymous form of reporting system where all healthcare providers can put in near misses or other problems that they see, The number of incidents that have been reported have doubled over the last few years, whereas the number of serious events occurring that then go to malpractice claims has decreased by 80%. So I think you can see how employing technology like NISQIP, you can really make headway, and we've been very happy to be partnered with the college in these efforts.
Quality landscape is changing. We're all working on it as hard as we can, and we have to ensure that as we're working on it, we need to measure in the best way, because at the end of the day, we have to be able to answer the question, are we in fact better than we were yesterday, than last week, than last year? And we have to know that we absolutely are. As we move forward, we really need to focus quality on the things that work, the things that are going to improve care, that are going to decrease burden, that are going to decrease the cost, improve resources, and at the end of the day, improve the care for our patients.